Hi YouTube, it's Kim here again today. Today I want to talk about diabetes mellitus. The definition of diabetes is the metabolic disorder where the blood sugar is high due to a defect of either insulin secretions, insulin activities, or both. Insulin is a very important hormone in the body. It takes the sugar, right, from a blood to be absorbed into a body and then be stored as glycogen, right? So carbohydrates. They are produced by pancreas. So risk factors and types of diabetes. So type 1 and type 2. Type 1 is when the pancreas can't produce any insulin or the production is very limited. This is due to autoimmune problems. So risk factors are that if you have a family history of autoimmune disease. And then type 2 diabetes is when you have insulin, but there's no sensitivity to it, so you can't use the insulin to take the glucose out of the blood. So risk factors are that if you have first degree relative who also have diabetes mellitus type 2, if you're obese, if you're old, more than 40 years old, polycystic ovarian syndromes, and eating a lot of fat, having high blood pressure, and the list goes on. What are the symptoms of diabetes, particularly in diabetes type 1 and type 2? More of type 2. So symptoms are if you have high sugar, right? You have the feeling of thirsty, you want to drink a lot of water, but you also go to the toilet to pee a lot as well. You notice some weight changes, okay? You're more prone to get yeast infections, and your visions can become blurry. And then you have DKA. DKA stands for diabetic ketoacidosis. As you know, glucose is used as for energy, right? Glucose is used as a kind of molecule to produce energy in our body. If you have low extractions of glucose from our blood, means we can't use the glucose, right? In this case, our body utilizes the fat, so they enhance the fat metabolism. So a byproduct of fat metabolism, as a result, produce a lot of ketones, which can be used to make energy, like ATP. So side effects of that, you can have like fruity breath, right? When you breathe, it smells sweet and fruity. You lose a lot of weight. You become nauseous. You might vomit. You feel weak and fatigue. You have this type of breathing called Kussmaul. So you use a lot of accessories muscles to breathe. And you feel dehydrated as well. The complications of diabetes, numerous. So high blood sugar can affect blood vessels. It can affect the big vessels or the small vessels. So the big vessels are namely like causing coronary artery disease, cardiovascular disease, and peripheral vascular disease. On the other hand, the small vessels, these are the common things you probably hear with diabetic patients. So small vessels, it can affect the kidney, so nephropathy. It can affect the eye, so retinopathy, and it also can affect the nerve, hence neuropathy. And all these symptoms, they're very common. Okay, treatment of diabetes, particularly type 2 diabetes, it's more prevalent. Type 1 diabetes, they usually tend to occur in younger patients. They show up in the younger populations. So they can be treated not using the drugs. So diet, exercise can increase the sensitivity, and self-monitoring of the blood glucose. And using the drugs, these drugs are called hypoglycemic agents. They are drugs to reduce blood sugars in the blood, right? So namely, they are metformin, so insulin, glycoside, glitazone, etc. Most patients follow SMART goals, which are namely A, B, C, D, E. So with A stands for HbA2, so hemoglobin A1. So A, B, C, D, E. A stands for HbA1c. it has to be a control less than 7%. So it's a measurement, a tool that we monitor for good indications for blood sugars. Lower than 7% is good. B stands for blood pressure, to be controlled under 130/80. C is to keep your cholesterol less than 2. And drugs, some drugs like ACE, statins, and ASA can be used in conjunctions with the drugs like hypoglycemic agents to keep it well controlled. E is exercise and eating. And lastly, S, which is smoking cessations. So it's A, B, C, D, E, S. So that's the end of the video today. Thank you for listening, and do not forget to like and subscribe.